As South Africa continues to observe COVID-19 health protocols, it's necessary to talk about the impact of these measures on families, students and children. It just cannot be ignored that for the first time, the social interaction of families, students and children is highly restricted. Joining us to talk more on this are Professor Boitumelo Diale, an educational psychologist at the University of Johannesburg, Professor Ramneek Aluwalia, CEO at Higher Health, Director for Social Cohesion in the Department of Basic Education, Liko Bottoman is here in studio with us, and Rhodes University student Kanyisile Mateke is in conversation with us. I'll begin with you, Prof. Diale. Can a pandemic be traumatic?
Yes, definitely it can be traumatic, as it is traumatic. It's not a doubt. As we see it currently, it is a traumatic context.
And how would you say this has been, traumatic, especially when you look at what some would term the childhood traumas that children go through? How would you measure this in relation to that?
One of the ways of measuring it is through development. As we know that children or human beings grow into different developmental stages. And for children develop through various developmental stages. And part of those developmental stages have to do with contextualization, socialization, with play, with being with other people. And in the context of the pandemic, they find themselves actually being in isolation, which is an abnormal situation. And any abnormal situation for a child impedes on their development and restricts them in terms of how they grow. Theirs has the potential of actually causing traumatic development on children.
Liko, it's been a very difficult balance that the department has had to strike here. I mean, listening to what Prof. Diale is talking about, the fact that the development of children is critical, when it comes to social interaction and all of that. But at the same time, you have to protect them from contracting either COVID-19 or being out there and exposing some of their grandparents to that. It's really been a tricky balance.
Absolutely. I think for many years as the basic education sector, we have been pushing an agenda that says education is a societal issue, because we knew that some of the ideas and solutions that we need to respond to the needs of children are going to emanate from society, from households, from communities. But I think before COVID, we didn't imagine what that should look like. We just had an idea, and the pandemic pushed us into a corner where we now have to put into practice what we mean when we say education is a societal issue. Because what it meant then was that communities, households, families needed to come on board and be more involved in the education of their children. And by education, it also then includes the development. It also includes the facilitation of social opportunities for children. It was really tough. Now, it's easy to reach children when they are in school. And I think that's why we've been pushing very hard, with all our partners in academia spaces and in civil society, that children must come back to school because it's easy for us to reach them. But when they are at home, in homes, in households and communities, it becomes difficult. Then it means then that responsibility lies with households. We can only give ideas, but households and communities and families need to then come on board.
It also lies with households, though, Liko, households that are they themselves struggling. They're impoverished, some of them, and they don't even have the means to connect their children to this online learning that, some grandparents, if I can even put it like that, had to try also see if they can navigate. Now, this has, in fact, once again, sparked the debate between the haves and the have-nots. And when you then are looking at that, how do you envision a future then for schooling? Because this has changed how we reimagine anything.
I think you're correct to say that it kind of pushed us again into a corner where we've got to deal with children on an equitable basis. So you deal with children, those who have got access to these online, digital and virtual platforms and opportunities, whilst you onboard more of them to be able to do that. And we've made quite a considerable amount of investment to ensure that more children gain access onto online, virtual, and so. But you're correct to say that. But then all of this is coming into families where there is no familiarity on how to navigate and how to facilitate, how to use this. Coupled with that is this thing that we call read to lead, where we say, let's promote reading for pleasure. We know that reading is a technical activity that can only be facilitated in the classroom. But in order for us to prevent regression of children, we've got to then promote reading for pleasure. Anything that families pick up that is developmentally and age appropriate, that they can read together. So we're saying that read for them and then read with them. And so when you read for them and with them, you have an understanding of how far your child can go and how far you can then stretch them as you facilitate that kind of learning. And so just because you don't have access to online platforms does not necessarily mean that you can't do anything. Sometimes there is learning through play. That if you play with your children, you're able to, to infuse some of these learning principles through play.
Interesting. I'd like to bring you in, Khanyi, to this conversation before I bring in Professor Ahluwalia, who, I'm going to ask just to also share some insights on what you raise. Let's talk about you. You are far from home. Your parents, sent you to school in Grahamstown, and you are separated from them. And there's been levels of lockdown where you've not even been able to travel to see them. Talk to us about the impact that this time has had on you.
It's been extremely stressful because on one hand, you have the pressure from school that you are urged to complete your degree in record time. And then you have this pressure from family because I'm the first one to go this far from home for my studies. And being alone has been very tough because I've grown up in a home where it was very hands-on, especially with our schoolwork. So they kind of know the type of learner that I am. I'm figuring that out for myself.
Khanyi, I'm going to ask them to try and sort out your line there, because what you're saying is quite important. I'm sure you were not even, able to hear some of it, but what I could hear is that she says that she comes from a close-knit family where everything was done together. Everybody got involved and all of that, and now she's finding herself alone and is struggling a little bit. Khanyi, you were still saying that for you, you are far away from home and you are used to having your parents hands-on when it comes to your school work. Talk to us about how the distance is impacting you.
It's been hectic, I'm not gonna lie, because also the fact that it's still lockdown, the pandemic is still quite hectic. The fact that we need to isolate and you can't see friends as often, and even when you're with them, you can't really have these study groups that we used to have and everything. So being alone and studying on your own and figuring out exactly how you specifically need to try and get through this time to complete your degree in record time has been quite challenging. The school has really tried to be hands-on, but at the end of the day, it really takes a lot out of you as a person.
Prof. Ahluwalia, I'm listening to Khanyi talk about the social interaction that she's craving, and not only just to spend time with her friends, but also to study with them. And this social interaction is not only huge for children, but students as well, because they also are looking to their peers for some kind of assistance. How big of an issue has this been for institutions around the country?
A very big, Bongiwe. In fact, Bongiwe, when we started with COVID-19, we knew it's a health pandemic. But as we have matured with this pandemic, we've now seen two more pandemics, which is COVID is now regarded as a social pandemic, and COVID is also now regarded as an economic pandemic. And let me explain to you why I mean there are three pandemics: the health, social, and economic pandemics running together. Like Khanyi, there are many more young students. We've got about 2.5 million of them, say universities, in TVET colleges, in rural areas, in peri-urban areas. And what is impacting is, imagine a young student at home who's losing out on study times, who has parents who probably are losing jobs or having economic challenges. Our study shows that over 40% of students are even struggling with food security in these difficult times. They are in households where there is lack of study space time. Electricity is a huge challenge. We are a developing country at the end of the day, internet, data. And then there's a huge pressure on them, which is skills development to become a graduate, succeed exactly the way they were supposed to succeed. Except for UNISA, almost all our institutions, including schools, were built for contact learning. And when we talk about contact learning, there's a meaning of contact learning. A lot can be done through a hybrid model, but cannot be achieved without a contact learning. And that's putting a huge psychosocial distress on young people. There's 65% of our young people through our study, which has been done across all our universities, TVET and CET colleges, has clearly shown 65% are suffering from moderate to severe anxiety, depression, and mental health disorders. And that's a reality. And this is predominantly a pandemic which is now impacting the society, impacting the economic situation, and it's going to, as it continues and matures, it's going to continuously impact the development, exactly as Professor Chumi was saying, and that is exactly what we are worried about, because as a skills development system, we cannot afford to have this, and that's where we are worried about.
I'm going to continue with this conversation in just a moment. And Prof. Aluwale, you touched on something that I'd like us to look into after this, the pressure that these children are finding themselves with at home, because there's also parents themselves who are overwhelmed during this time. Some of them have lost jobs. Some of them are struggling with just the impact of COVID-19. And now you have young people who are just as overwhelmed. So how do we then begin to navigate these spaces? Let's continue with this conversation in just a moment.